Hey Mob, I'm Rachel Hocking, a Warlpiri woman from Ladjamanu, currently living on Gadigal land in Sydney. But as you can see, I've made it back home to Ladj. I'm a journalist, a storyteller, and now a very proud NAATSIHWP Ambassador.
Hi everybody, I'm Hayley Longbottom. I'm a Jerinja Kalangati 1D1 Dandian woman from the south coast of New South Wales. And I've been working at Waminda now for 12 years. For 9 of those years I've been a health worker here at Waminda.
Kinagay, Emma Donovan here. I've got all my mob over in Western Australia, Yamaji, Bibbulman people on my father's side, and my mother's family, Gumbanga and Dangari people from mid-north coast of New South Wales. And I am a songwriter, I'm a mother of 2 girls, and I play with a band in Melbourne called the Putbacks.
The importance of the health worker, health practitioner career pathway for us here at Waminda is that we are actually health worker, health practitioner led, and that means the continuity of care for our communities is led by the Aboriginal health worker practitioner workforce. So we're trusted by the community, we have those strong relationships, and the GP knows that that's how it operates, and that means they get more time with our community also. It is the most rewarding career, and it is that a career in its own right. It's not a pathway to nursing, it doesn't need to be that. And we love it here. We're able to immunise, take bloods, and offer the social emotional wellbeing support, and it's beautiful. It's a beautiful career to be able to be enriched and stay grounded and remain in your community to support the thriving of our communities, not just surviving.
Aboriginal and Torres Strait Islander health workers and practitioners are important to our community because we see them when we come to our communities, our AMSs and our health services. It's important for our young kids and everybody in our community to see our own mob helping us with our health.
I can tell you, I've benefited from the compassion and the care of our health workforce pretty much since I was born. Whether it was the clinic just up the road here in Ladj, the Danila service in Darwin, or the Aboriginal medical services down in Melbourne and in Sydney. Without our Aboriginal and Torres Strait Islander health workers and practitioners, myself and so many others can feel pretty alone accessing mainstream services. We also know that work doesn't come easy, that behind the scenes, every single day, our health workforce is fighting for recognition of our ways of being and doing. For that, our communities are indebted to you.
I have a message for Aboriginal and Torres Strait Islander health workers and practitioners, and it's my big love and thank you to these workers for being there in our communities. There's been a lot of roles that we've had over the years and growing up with our aunties and our mums helping give birth to women. That's part of our health and that's part of our growing in our community. And I just want to say a big love and respect to all of our health workers that are there for our communities.
If you service Aboriginal communities or have Aboriginal or Torres Strait Islander people coming to your organisations, it's vital that is there to be able to support our communities how we know that they need support.
My big love and thank you.
Thanks.
Thank you from the bottom of my heart.